Hi, I'm Dr. Eric Mazer. Our Ask the Doctor question today is, what is the benefit of testing only when appropriate and eliminating unnecessary hospital tests? With me on the set is Dr. Jason Orlinick. He's Vice President of Medical Affairs at Norwalk Hospital and Chairman of the Department of Medicine. He's recently done studies on this and implemented procedures here. What are the benefits of avoiding unnecessary testing, Jason?
So sometimes you find things that you don't necessarily want to know about, and that leads to more testing, and more testing leads to...
And anxiety, too, I think.
Absolutely, yeah. And also complications that come along with that. So I think one of the examples that we've talked about is, doing additional CAT scans. So you find something, maybe you're not going to do anything about it right now, but you want to follow it up. So you're going to get a CAT scan every 3 months, every 6 months. Each time you do a CAT scan, you're exposing somebody to radiation. And we're not talking about radiation like a chest x-ray or dental films. We're talking about a lot of radiation that down the road, many years from now, can lead to a malignancy, a true malignancy. And so there are downsides to every test that you're going to do, potentially. And so you want to be cognizant, you want to use your clinical training and your critical thinking about when it's actually appropriate to do that. And there are guidelines for certain things, and there are guidelines against doing certain things.
And we've only got about 30 seconds left. How do you explain that to a patient? Because they think most patients think testing is good.
Right. I think you have to take the time and explain to them why you're making the decision you're making, where it's rooted in the medical literature that supports it. And I would say 90+% of the time, patients totally understand that, and they trust their physicians and will take their advice.
Now, that's really good to know. We probably need more discussion about this area in the future, because it certainly adds to cost and morbidity and even rare mortality. So thank you very much, Jason. That's really important.
My pleasure.
Unfortunately, we've run out of time. I want to thank my guest today, Dr. Jason Orlinick, for joining me on Health Talk, and thank you for watching. Please share your questions and comments with us at healthtalk@nuvancehealth.org. We'd love to hear from you.